Hello, I'm Dr. Rhonda Johnson. Today is Tuesday, November 12th, 2024. Today, I'm doing an alert about pertussis, also known as whooping cough. While the Center for Disease Control reports a significant rise in whooping cough cases this year, with 5 times as many cases compared to last year. And folks, this surpasses pre-pandemic levels. So what is whooping cough or pertussis? It's a highly contagious respiratory illness that poses severe risks, especially to babies under 1 year of age. Pertussis is caused by a bacterium. It's called Bordetella pertussis. And what it does, it damages the respiratory tract. It spreads through the air through coughing and sneezing when an affected person coughs or sneezes. Symptoms begin usually 5 to 10 days later as a common cold, but then progress to severe coughing fits. They're called paroxysms that can last for weeks. So why is this so dangerous for babies? Well, because it can cause apnea, it can cause pneumonia, it can cause severe complications such as convulsions or seizures, encephalitis or brain infection, and even death. Now, for treatment, early administration of antibiotics, particularly in the erythromycin class, is crucial to reduce the severity and duration of symptoms. And supportive care such as rest and hydration is very important. Now, a lot of babies, in fact, most babies will need to be hospitalized to manage their complications such as dehydration because they're coughing so much they can't get their nutrients in. So vaccination remains the most effective defense. Please ensure that your babies, your children, your teens, pregnant people are up to date with their pertussis vaccination to safeguard against infection. Now, I had pertussis myself. I somehow or another got infected as an intern. I will never forget how much I coughed. For 2 whole weeks, I felt like I was coughing my brains out. And then the cough persisted for months, but it lessened in severity over time. So pertussis is a very severe infection if it goes untreated. And I think my case, it was a couple weeks before I was diagnosed, and I didn't even realize I was coughing so bad till, one of the nurses made me go to the employee health area, and I got tested and came back right away as positive. So I take pertussis very seriously, folks. And I hope that you will get your immunizations because the vaccine can become less effective over time. That's why we need our boosters for throughout adult life, really. So check with your healthcare provider to see if you're up to date and see if your children need to be vaccinated. That's my message today. Take care, folks, and be well.